Let's go over myocardial infarctions or heart attacks. MIs are caused by a blockage in one or more coronary arteries. Now, don't get this confused with angina, which is a narrowing of the coronary arteries. MI will be complete blockage, so think that angina will come first and then MI. Biggest cause of MI is atherosclerosis, a buildup of plaque in the arteries that causes this blockage. This happens due to these risk factors. The number one sign of MI is chest pain, pressure, discomfort, but you may see any of these signs as well. If a patient exhibits any of these, we do testing right away. We always get an EKG and we can check troponin levels, gather patient history, or check other labs. Most importantly, we have treatment, what we'll do right now, what we do next, and what we'll do after that. Right now, think Mona. I think of chest pain will make you groan and moan, so moan for Mona. This will help remember the components of immediate treatment, but you may not necessarily give them in this order. Next is cath lab. Two interventions are TPA or PCI. We do not give TPA through a central line, and PCI uses contrast dye, which means the kidneys die. And after all that is done, we prevent or stabilize the clot and encourage rest.